Thank you.
Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh. I'm Dr. Muhammad Sani Menege, a consultant otolaryngologist, ENT head and neck surgeon, and epidemiologist as well. With the time we live in, we all agree that we're living in very extraordinary time. And following the media and most news channels, we see that the topical issues now is coronavirus. And oftentimes, the information when you do receive the summary is scary, is quite booming that if somebody could feel that is going to get depressed at the end of the day. So I just feel let's put some few statistics in reality in terms of what research have proven. So today, having gone through the introduction, the source, the transmission of coronavirus, so I want us to look at the clinical features. How does it present? So that's what is called incubation period, which is actually the period when somebody contracts disease and the time somebody begins to show symptoms. The exact incubation period is still unknown, but is known to be, from the data available now, it's about 2 to 14 days with an average of 5 days, especially experience from Italy. Now, the spectrum of illness actually can vary from the very mild form to the very severe form, but oftentimes the most severe illness is found in the elderly and those with underlying medical problems like uncontrolled diabetes mellitus, hypertension, lung, and those who are chronic smokers. But generally, in about 81% of the patients so far seen, according to data from joint WHO and China, it shows that about more than 4/5 of the patients present with mild illness. And severe illness we're only seeing in just for about 14%, those that present with pneumonia on CT scan. The critical disease, those ones that have respiratory failure, shock, multi-organ syndrome, they are just in 5%. But the overall fatality rate is ranging from 2.3 to 5%, which is not really bad compared to SARS of 2003 and MERS of 2012. So, but what are the ages affected? Mostly this is a disease of the middle age from 30 years and above, but it's more critical among the elderly people. And symptomatic infection in children appears to be very uncommon, and if usually do happen, it tends to be very mild. And it has been shown that males are more at risk of this disease. Then the presentation really is a variety of symptoms. 88% of them present with fever, and then fatigue in 38%, dry cough in 67%, myalgia in 14%, and dyspnea, which is difficulty breathing, in about 18%. Other symptoms that might not be specific are headache, sore throat, rhinorrhea, nasal discharge, gastrointestinal symptoms like vomiting and diarrhea. And recently from Iran and Italy, we're learning anosmia, just loss of smell, and dysgeusia, loss of taste. But the bottom line is that 80% of these people will present with mild to moderate disease, and nearly about just less than 12 to 13% present with a severe disease that warrant admission and ventilator. The clinical illness is in only 6%. So that's really a good news. It's not something to scare everyone around. Thank you so much for your time. Assalamu alaikum wa rahmatullahi wa barakatuh.